Hey everyone, my name is TFowlds and I'm a former student from Mission College. I graduated from 2012 with my degree in health sciences, where I then transferred to Mount St. Mary's University, attained my BSN in nursing, and I also obtained my minor in business administration. I am currently working at Ronald Reagan UCLA Medical Center in the cardiothoracic ICU, and I've been there for a little bit over a year now. And so the reason I'm doing this video for you is so you can know firsthand of why it's so important to get your hands dirty prior to pursuing your degree in nursing. And so I only have 4 reasons for you as to why you should pursue the CNA program in hopes of getting your CNA license or CNA certificate and just getting your career in nursing started. And so the first reason is not only do you get firsthand, you get hands-on experience, you get exposure as well. So not only are you going to be obviously working alongside the nurses, but you will be working with the doctors, the nurse practitioners, respiratory therapists, patient transport, x-ray techs, phlebotomy, lab, everybody. So you literally work with everybody, depending on where you actually work. And so if you work at a long-term facility, a hospital, anywhere, even home health, so you always get exposure, you always get that experience, but they also get to know you. And so that actually leads into my second reason. So it helps with networking. It's all about who you know in this industry. And if you're a CNA and you're working alongside doctors and nurse practitioners and other nurses and charge nurses, you do develop relationships, work relationships, and they get to know you. Is this person reliable? Is she trustworthy? Is she late to work? Is she always on time? Is she always very careful and meticulous with what she does? Does she follow policy? So this is kind of like, if you think about it, it's an ongoing tryout of what you'll be doing later. Because what happened with me was that I was actually working as a care partner, which is a CNA. We just call them care partners at UCLA. I was working on one unit, my current unit actually, and I knew I wanted to work on that unit, and so I worked my butt off trying to pretty much let my name be known. They all knew I was a nurse. I was pursuing nursing. They knew I was in nursing school. I'll be graduating in a few years, and just that relationship that they got from me. Just they saw my work ethic. Right away, as soon as they heard I graduated, they immediately told me, you should apply. We really want you. And sure enough, I've been there for a total of 3 years now, and 1 year as a nurse. And so it does help. And even if you end up not being at the place where you're currently working as a CNA or will be working, you can, like I said, it's always word of mouth. One person, a doctor can know a different doctor at another hospital, shoot your name through a letter of reference, and then, there you go. What better way to graduate when you have a job lined up for you afterwards. The next topic I want to talk about is I just want you to ask yourself, is this job really for me? Meaning nursing. And it's funny because the reason I ask you that is because from experience, I've actually talked to a few people who I ran into, a few years back, and then ran to them recently again. And I said, hey, catch up, usual catch up, small conversation. And I said, oh, so what do you end up doing right now? And they said that, they actually wanted to be a nurse, but they chose to not be a nurse. And when I asked them, well, why is that? Oh, well, I just didn't want to have to deal with blood. Yeah, I said the same thing. But, good for them. I'm glad that they realized that aspect of it and that big portion of nursing skill that you are going to have to deal with early on. That way that they wouldn't be in nursing school or even as a nurse first day, and now they have to deal with blood. And another person actually told me that they changed their mind about nursing because they didn't want to have to deal with another person's bodily fluids. Which, yes, I'm sorry, it is a part of nursing. Your patient goes in the bed, who's going to clean them up? It's a holistic part of care. It's total patient care is what everyone says, which it is. But another reason why I asked that is because, true story, very good example. I repeat it every single time I have talks for pre-nursing students. My first semester in nursing school, we had 10 students, and it was our first day of clinical. And so we show up, and the first day, one of them didn't come. And so I'm thinking the worst, everyone's thinking the worst because, you just don't show up till late to clinical. And lo and behold, we find out that that person actually dropped before the deadline. And so we're like, oh, well, we wonder what happened. Pretty much just up and left, which is fine. Probably just didn't think nursing was what he thought, which is what, the rumors were. But that's totally fine. He actually found a different career path and he's happy now. And so later on, I find out that two of my other friends were actually failing a couple classes and they were forced to drop the entire program in general, or else it would count against them if they wish to transfer to another program. And so I don't know what the full details on about that, but lo and behold, there's already 3 down from a group of 10. And so here comes spring semester, and I run into another one of my friends, and I say, hey, we're just catching up. I wonder if she was in any of my classes again, of course. And she tells me that she actually is not doing nursing anymore. And I was a little surprised because she was actually very good. You kind of just get like that vibe from people. And so I asked her what happened, and she was like, just nursing just wasn't what I thought it would be. And honestly, it happens more often than you think, in any job actually. The job isn't really what you think it is until you're actually doing it. And so she went ahead again, another career path change, and she's happy. And so good for her. And so, yeah, only 6 out of 10 of my group for that year made it. And, it's a little eye-opening, when they say that nursing school is tough. It is tough. And it's also good to know, what are your reasons for being in a nursing school? Why are you applying to be a nurse? Why, just why? Why are you choosing nursing? And so the reason why I say that is because you're going to have a lot of blood, sweat, and tears into this profession, not even getting into the job yet, just preparing to get into the job. And it's going to be a lot of money. And I'm not even talking about just tuition. I'm talking about books, food, commute, gas, wear and tear on your car. If you end up moving, you end up dorming. It's a big financial hit. And for those of my friends that actually got into the program and already almost 3 months, a full semester into it, realizing that nursing wasn't for them, I was like, whoa, well, I'm glad that you decided now, but then, good for them because they're happy with their career choices. But on the back end, they took away 4 spots in my cohort of people who really did want to be a nurse and did want to see it through. And so just kind of keep that in the back of your head. Why are you doing nursing? Is this really for me? Because it's not just patients. You're dealing with families. You're dealing with doctors. You're dealing with other nurses, nurse practitioners. You're dealing with the whole range of departments. It's not just, you and your patient and that's it. And so just keep that in mind. And that's number 3 of why you should become a CNA first. Okay, and this actually leads into number 4. So if I still have you engaged, I hope so. For those of you who are not afraid of what I just said, what it does help with, meaning this CNA program and becoming a CNA and getting, the first 3 points I just discussed completed, you get brownie points. Okay, so I'm not just talking about brownie points for your application because it does help. I understand that a lot of the schools go by point system. And so some go by you just having your certificate in general. You get points for it. There's points for you actually working a number of hours. So how long have you actually been doing it? And it also helps with your resume when you actually start applying for a different job. So let's say you start at one location and you want to go ahead and try a different location. You want to go from a long-term to a hospital or acute setting. It helps with that because, everyone likes experience. But it also shows not only your nursing school, which you are all going to be applying to first, your nursing program, but it shows that you can time manage. It shows that you can prioritize your time. It shows that you understand the work stress of everything. You're able to manage your school and your work and your family and all the ups and downs that can come with it. And so it also shows, oh, I am on time for work, because you have a letter of reference from your job. And then it also shows that you can be balanced. You're engaged. You're clearly working in the field already. You're serious about pursuing nursing, and yeah, it just gives you like a higher advantage. I would say, because like I said, you're in the field already, and you're getting your exposure in the first 3 things I've already discussed. And so I hope I didn't scare any of you. Okay. Nursing is, the best profession. I'm biased. It is a very good profession. You're getting already your feet wet just by coming to this orientation already. And so just understand that nursing is hard, but it is very flexible. It's very gratifying. It's humbling at many times. You get to learn something new every single day. No matter if it's your first day or your 20th year on the job, there's always something new to learn. But I hope that these 4 key points can help you decide whether you want to pursue this or you want to wait, or whatever the case may be. If you have any questions, comments, concerns, if you want to just reach out and just chat with me, I'm totally open for that. Just go ahead and reach out to Dr. Parr. She has my information. And yeah, thank you for listening, and I hope that your career in nursing is a very successful one. Thank you.